P syndrome, rheumatoid arthritis. The clinical manifestations of RA. First stage, swelling of the synovial lining, causing pains, warmth, stiffness, redness, and swelling around the joint. The second stage is rapid division and growth of cells or pannus, which causes the synovium to thicken. Third stage, the inflamed cells release enzymes that may digest bone and cartilage, often causing the involved joint to lose its shape and alignment, more pain, and loss of movement. So we now have here the joint degeneration that occurs in rheumatoid arthritis. In Chinese medicine, the synovial fluid will have something to do with the kidneys, the cartilage would be the liver, the synovial membrane is the liver. Loss of cartilage is called liver deficiency. Increase in synovial fluid is dampness. Hypertrophy of pannus of synovial membrane is dampness and phlegm. If the pannus erodes the bone, this is kidney deficiency. Pannus extending over the articular surfaces would be phlegm. Total destruction of articular surfaces and loss of cartilage, liver kidney deficiency. Deformity of the capsule by fibrosis is phlegm. RA can start in any joint, but it most commonly begins in the smaller joints of the fingers, hands, and wrists. Joint involvement is usually symmetrical. In general, more joint erosion indicates more severe disease activity. Other common physical symptoms include fatigue and stiffness, particularly in the morning and when sitting for long periods of time. Advanced changes include damage to cartilage, tendons, ligaments, and bone, which causes deformity and instability in the joints. The damage can lead to limited range of motion. Although ancient Chinese medicine obviously could not have a conception of autoimmune disease with regard to painful obstruction syndrome, it did consider certain forms of painful obstruction syndrome more serious than an ordinary invasion of external pathogenic factors. These were variously called multiple joints wind, or stubborn painful obstruction syndrome. The nodules in the joint seen in RA were called silent scrofula in ancient Chinese medicine. From a Chinese perspective, the clinical manifestations of RA often clearly indicate damp heat. In fact, the small joints are swollen, dampness, red and hot to the touch, heat. As the pain often moves from joint to joint, there is also an element of wind in this disease. However, please note that although damp heat is the most common manifestation, there are also conditions of RA characterized by cold dampness. Thank you for listening.